In our next segment, I want to go into some more of the local issues, some more of the Minnesota issues, but let's go back to how we get rid of Obamacare, how we get a free market health care, not only in Minnesota, but in the United States.
Well, free market health care in the United States is really going to it's going to take all of us having ownership of our individual policies. So we all should have an individual health insurance policy, I would contend, even before birth. I think parents should be able to buy them for their child when there's a risk that's known as to whether or not there will be a difficulty, a chronic condition or whatever with this child. And we should all own them from before birth. And if it goes like you don't like that insurance policy, fine, you can change. But for the most part, all of us would have it just like our life insurance policy, where we don't look at it, where we do most of our paying for health insurance, paying for health care through our cash, through a check, through a credit card, and the health insurance policy would be a catastrophic. It would be truly what insurance is about, which is to cover that for which you cannot save, and that which is considered a rare incidence.
Like your homeowner's policy or your car policy.
Right, right. Like any of those. We should not even be thinking of pulling out a health insurance card at the doctor's office. We should just be paying cash. If we end up in the hospital, that's when health insurance should come into play. And that way we could really keep all the costs down. We could have, even if you're not covered, even if you choose not to be covered, the prices are likely to go down because now it will be all about cash. And now people will be looking, they'll be careful, there will not be all the paperwork. So this is where we have to go. I think long term, this is where we have to go. That also means the end of Medicare, because we would keep and own our own policy that we have put money into since the day we were born or since we were a child. And there's no reason to suddenly get on the dole, as it were, when you turn 65. There's no reason to do that. And as we're seeing now with Medicare, that's going to be a very dangerous thing because, President Obama took out $500 billion from Medicare. That's going to come out of people's access to care, without a doubt. And so I think that the public is going to realize soon how much rationing of care is going to take place in Medicare as all those baby boomers come in, as it becomes insolvent, as taxpayers refuse to pay as much as they have to pay in order to cover all these people with everything. I mean, that's what we want, is we want to move people away from rationing and into a place where they and their doctors have control over their medical decisions. And they can ration their own care if they want, or they can go, choose a cheaper option.
Why do you think government will ration care?
Well, it's without a doubt that government will have to ration care. First of all, as I said, the Medicare is becoming insolvent. Second of all those seniors are going to come in. Third, we already know they're going to ration care because they took they took $500 billion out of the Medicare budget. So we know that. But what's really important to understand is that we're all individuals. If we have 77 million baby boomers coming in, there's all sorts of different things that they're going to want. And the whole federal infrastructure is being set up to universalize or standardize medical treatments, which means they will decide for everyone at every age what is available and what is not, and what will fit in the budget and what does not fit in the budget. So there's no way that they cannot ration care unless we want to give up our defense and every other thing that there is that we consider important in this country. So in order to protect the country, to keep our defense, to keep everything else, we're going to have to ration care. And that's why it's better to get out of a system that's going to ration care than to stay in it.
Do you think it's possible?
I do think it's possible.
I do too. I really do.
I know it's possible because Americans are very, they're used to getting what they want. They're individual thinkers, they're creative, they're innovative, and I just will not believe that we will become a nation of dependents, willing to have our health care and our lives taken away from us through rationing. I don't believe that. And I think when it becomes crystal clear, as it is becoming now with IPAB, the Independent Payment Advisory Board that was instituted under Obamacare, people will say no. And they will start to say, how can we get out of this? And what can I do to get out of this? And so I think it's really important to have the solutions there. And those solutions, part of them are in Paul Ryan's plan, but part of them are outside of Paul Ryan's plan. So Congressman Ryan, his plan to have only be focused on health plans. Well, I don't think that's a good idea. We have to have a system where you can have traditional insurance. not prepaid health care. Traditional insurance is where you can get to the cash basis that I've been talking about. And health plans might be for some, but they won't be for all. And that's why if we have our own money, we get to decide who gets it and how we want to be taken care of.
The part that we're all individuals. What you need for your sickness versus what I need for my sickness are two different things. And when government comes in with a cookie cutter approach and says, sorry, we're only doing A, B, and C, I think it's going to drive the American people crazy.
Yes. Yes, it's going to make them angry.
Yes.
It's going to make them demand something else. It's going to, I mean, you can look at you and me and you can say two women, right? We could have the same disease, but the fact of the matter is, right down to our DNA, we differ. And our philosophies might differ, our belief system might differ, our willingness to comply with a certain medication regime or our ability to comply with it. Completely different. And so there's no way that you can look at each of us as cookie cutter people for which we can have cookie cutter medicine. You know, it just won't work. And that just defies what medicine is. I mean, I'm a nurse and I know how individual people are. And we have to look at them as individuals, treat them as individuals, and keep their dignity. It is not dignified, it does not uphold their dignity to treat them as though they were their neighbor down the street, as though they aren't individual unto themselves.
Okay, let's talk about some of the issues here in Minnesota. And there's so many, Twila. There aren't enough hours to go through all of these. I just want you to touch very briefly my favorite website of yours, itsmydna.org. Itsmydna.org. And I love it. And here in Minnesota, our baby's DNA is gathered and turned over to the government.
That's right. And most parents do not know this, and it happens at birth. And so since your listeners don't know it, I'll just kind of refresh here. And that is that when the heel of the child is pricked at birth, that blood is put on a special filter paper and sent directly to the health department. The hospital lab does nothing with it. And the health department about 14 years ago decided by an executive decision that this was very valuable, the DNA of the children, and they started to keep it.
14 years ago.
14 years ago.
Anybody who has a child under 14, pay attention.
That's right. Yes.
Itsmydna.org.
That's right. And so the government laid claim to and considers owned the DNA of children for the last 14 years, and it's almost 1 million children so far.
Oh my God.
And we did change the law in 2003 and gave people the right to opt out, but the health department hasn't bothered to tell anybody. And the hospitals don't know it because the health department hasn't made a big deal of it for them to know about it. And so probably the only people that opt themselves out and take their baby's DNA out and protect their child from government ownership and analysis of their child's DNA are the people who are on our list or come to our website or whatever. But I do know that more and more people are choosing to take their child's DNA out or to have private testing at birth, because a lot of parents really like the testing. I don't think that they will when they decide to do a full genomic scan of the child and they want to know everything that could go possibly wrong with the child in their lifetime. I think then it will become way more controversial. But today it's only newborn illnesses. And so most of the parents are really agreeable to that, but they don't like the idea that the government has their children's DNA, owns their children's DNA, has been sharing it, doing research on it, all without the parents' knowledge or consent. I am happy to report that as a result of our efforts in Texas, the Texas legislature just changed the law to require consent for both the storage and the research, and I'm thrilled. And we should have that happening here in Minnesota, but so far the health department has completely opposed it, and we are waiting now for a Minnesota Supreme Court decision for the justices to rule as to the case of 9 parents who sued the health department for violation of the Minnesota genetic privacy law, and hopefully that will be in our favor.
I hope so too. I'm counting my blessings. All right, another battle that we fought here in Minnesota was electronic health records. I think most Minnesotans don't know our medical records are sitting in Maine.
No, they don't. Yes, our medical records are sitting in our doctor's office, which is connected to probably the health data system of the health plan. And most people don't know that either. And it's all becoming very linked together, very connected. And they promise they'll keep it safe. And they promise they'll keep it safe. Yes, they promise to keep it safe, and they promise privacy. But as we know that when the government or other people have access to our medical records without our consent, they've already broken the privacy. The confidentiality is all gone.